Every single one of us in our country knows someone who has died of AIDS. Every single family in the rural communities, in the suburbs, in the townships, we all know someone who's died of AIDS. We've had millions of AIDS deaths, and one of those deaths has affected each one of us. So that changes people's attitudes. They become less judgmental, they become less condemnatory, they become less ostracizing. But the other much more beneficial reason why stigma is reducing is treatment. I've been living on treatment for nearly 15 years now. It's very close to 15 years. People realize that this isn't a death sentence. They realize that this is a fully medically manageable condition. So that has really changed things. People are now talking about their treatment. They're talking about being on ARVs. I think it's also helped that from World AIDS Day 2010, we had a mass public drive to get people tested for HIV. I think that's been beneficial. It is quite a miracle, very close to a miracle, that AIDS is treatable. And I'm obviously a beneficiary of that miracle, because I'd have been dead 10 or 12 years ago if there hadn't been antiretroviral treatment. But a virus is a very difficult thing. That's why we've got colds and flu. If they'd known how to deal with viruses, we wouldn't have any colds and flu. If I stop taking my treatment, within 3 to 6 months, I'll be very sick. So there's no cure at present, and that's because this is such a difficult virus to deal with. To be diagnosed with what was in 1986 a fatal condition is a tremendous shock. To be diagnosed with what is not only fatal but a stigmatized condition was even worse. So it profoundly altered my life. It altered my life. I was a young man in my early 30s when I was diagnosed 26 years ago. It profoundly altered my life. If I know now if I knew then what I know now, I would know that despite falling sick with AIDS, that I would recover and that I would lead a healthy, physically vigorous life. I wouldn't have felt so shattered, but one acquires that knowledge only with great pain and at the cost of very great experience. I have been treated differently in certain ways. For example, when I fell ill with AIDS, I was a judge. I'd been a judge for 3 years, but the judge's medical insurance didn't cover AIDS. So I had to pay for the first few years for my treatment out of my own pocket. It was completely discriminatory. A cabinet minister like Joe Slovo, just before I fell ill in 1994, he became a cabinet minister, but at the time he became a cabinet minister, he was seriously ill with cancer. All his hospital costs, his treatment costs were covered by the same medical insurance scheme that judges and parliamentarians are on. I experienced discrimination in that way. On a personal level, it's very hard to say, because people won't say to your face. It's like race discrimination or homophobia, people who don't like gays and lesbians. I'm a proudly gay man. It would be very difficult for someone to say to me, I don't like gay men. It's hard to say if people don't like you, whether they don't like you because you're too tall or too bald or too big or too outspoken, or because you're too gay or because you're too HIV positive. It's always hard to say that. But I must say that once I've made my public statement about living with HIV, I got enormously positive reactions, enormous love and affirmation and acceptance, almost universally. Got 1.7 million people in this country who are taking antiretrovirals. Most of them, I'm on private medical insurance, but most of those 1.7 million people are receiving them through the public health system. This is an enormous achievement. The fact is that 99.99% of people who get infected with HIV will fall sick and die unless they get access to antiretroviral treatment. Favorite leisure time pursuit is cycling. Road racing, I do cycling. I do the 94.7 and the August cycle race. I did a cycle race 3 weeks ago called the Rand Water Race, 110 kilometers. So I love to keep fit. I love to watch movies, and I love to read, and I love to be with friends. So those are what keep me occupied when I'm not working. We've got to improve treatment. We've got to reach out to more people. If every person in our country could go for a test, agree to go for a test, be tested, and find out their HIV status, and then take preventive measures, either get onto treatment or ordinary safe sex practices, we would stop this epidemic. If we could find every last person today in our country, 5.6 or 5.7 million out of 49 million people who had HIV, and reach them and say, start on treatment or stop doing any risk behaviors, we would stop this epidemic. So there's a lot more that we can do. We haven't reached everyone who needs treatment. We haven't reached everyone who's living with HIV. So we can test a lot more, we can treat a lot more.